In August of 2020, the corporate medicine structure, they wanted to shut down our clinic, turn it into a nurse practitioner fellowship training site. So doctors weren't allowed anymore in my clinic. But they rolled out the red carpet for me to go anywhere in the system that I wanted to go. I didn't want to go anywhere else. I didn't love corporate medicine to begin with.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. I'm here today with Dr. Erin Kallock. Thanks for being here.
Thanks for having me.
Thank you. So you are the founder and owner of Focus Health DPC in Tacoma, Washington. And she's dual boarded in family medicine and obesity medicine, and married and has 3 children who are not back in school yet. They're almost there. 13, 11, and 9. So I wanted to start out with having you tell us a little bit about your practice, how you got into it, and let's just start there.
Okay. My how I got into it story, as a lot of stories have, mine involves COVID. I let's see, I never wanted to work full time in corporate medicine, right? Because everyone had said if you do full time, then you're going to be working 70 to 80 hours a week like you did when you were a fellow and resident. So I was always 3/4 time, technically. But I did OB. My fellowship was in rural family medicine, and so I accidentally learned how to do C-sections along the way. So my partner and I just loved working together, and so we did a lot of OB. We did a lot of high risk OB. We did a lot of C-sections, and so you really need to do that in a corporate structure, right? I can't really do OB in the direct primary care world. So I had heard about DPC because it actually started in Seattle, where I trained. And I had even applied to one of the direct primary care startups, the Q Alliance, people have heard of probably. But they were like, you want to do OB. You can't really do that here, right? So DPC was always sort of in the back of my mind. And my partner ended up getting her dream job in Oregon. So she left and COVID happened. And so my 3 children were all of a sudden at home, and they were much smaller back then, right? So I was trying to make it work with my doctor husband. He was working in clinic Monday, Wednesday, Friday. I was working in clinic Tuesday, Thursday, and we were doing parenting full, it was kind of a mess, as it was for everyone. And in August of 2020, I just realized, the corporate medicine structure, they wanted to shut down our clinic, turn it into a nurse practitioner fellowship training site. So doctors weren't allowed anymore in my clinic.
Not allowed.
And like, see you, lady, you're too qualified.
Crazy.
But they rolled out the red carpet for me to go anywhere in the system that I wanted to go. But I'd had a great partnership with the nurse practitioner I worked with that my partner and I had hired when she was pregnant, actually. And, she was pregnant, showing up fearful that she would never get hired as a pregnant woman, right? But we loved her. And so the 3 of us worked really, really well together. But so when my partner Heather exited, stage left, they just decided you can go anywhere in the system you want to go. I didn't want to go anywhere else. I didn't love corporate medicine to begin with. And I had already thought that this much OB was not a great idea for family life. And my husband was not a fan. He's an internal medicine doctor, the ones that hit Control Alt Delete on OB knowledge when they graduated from med school. So it just seemed like we needed to make a shift. And so I left the corporate structure and thought, I'm leaving medicine. I don't like this enough to keep doing it. I really don't. In terms of being in a situation where everybody was losing, right? I was working, even as somebody who never committed to full-time work, I was working full-time plus hours, and everybody was unhappy. The medical assistants were unhappy because I was trying to squeeze patients in who had my cell phone number because I had done OB, right? So I was the on-call doctor. So lots of nurses had my phone number. So they would just text me and say, your office says you can't get me in for 3 months. Is that really true? And so I'd say, no, sure, come on in. But then the MAs are unhappy because they can't get to lunch on time. They can't get to their daycare on time. Totally understandable. The patients are upset because they're waiting in the waiting room for a long time. The front office is upset because they're having to deal with my patients that just show up and say, no, really, I texted her. She said it's fine. And then my family was unhappy because I was charting into the wee hours. So I left thinking this might be it. I might have trained for a really long time and still don't have my student loans paid off. And yet I'm done. And so I told Julie, the nurse practitioner, if I come back to medicine, it will be in the DPC world and I will work really hard to make it successful enough to hire you back. And so she was like, okay. So we just kind of kept in touch and I started the DPC at the end of 21 and in fall of 24, Julie joined me. So
Awesome. That's awesome. So, you said your husband was not a fan of OB in general, right?
yeah, I mean, nobody was a fan of being a dad who's waking up, you know, in the middle of the night and realizing I'm gone, right? And so he's like, well,
Got it.
when is she going to be back? Is this is this a quick delivery? Is this a 2-day delivery?
Hmm.
He did not, understandably, he didn't love that. And my my daughter, who was 2 at the time, 2.5, she knew when within 24 hours when my husband had purchased a new phone for me. It was a different color and she knew that it had switched. And so I didn't, being on call all the time, when I had a pager that I wore on my pants, that was one thing, right? But when my pager became my phone, and so my phone was glued to me, anything your parent does all the time, you want to do too, right? So she just, and that sort of weirded me out and made me
Yeah,
realize
not great.
this isn't what I want.
Hmm.
Yeah.
So when you decided to do DPC, what did your family think?
Uh, I can't say that. I can't say that my husband and I had the types of discussions about it that one ought to have with one's spouse when they are starting something really
I
big,
don't think I did either.
right? Like, we remodeled our entire house, took it down to the studs. Like, we need to update the electrical and the plumbing. And we probably need a little of this and a little of that. And, it's built in 1925. So we did that without a plan. We thought we had a plan. In retrospect, we did not have a good plan for that remodel. And similarly, I think with the DPC, I did not do due diligence with the whole create a business plan. Like Julie Gunther with her 3 months of building a business plan, that
Hmm.
was not me.
Hmm.
So
Yeah.
I just thought, I'm going to do this. And I was privileged in the sense that I didn't have to make it financially successful right away, right? Because we have my husband's income too. So, and we're pretty frugal people for the most part. So there wasn't this pressure to be financially successful within 3 months or you have to give up the whole dream. And so it felt a little, in retrospect, it feels like I was kind of play acting at it a little bit at first, right? And all the other DPC docs were like, don't worry, it'll grow, slowly but surely. And you only need enough light for the step you're on and just figure this out. And then the next thing will pop up. And what they really mean is like, if you don't do the 3 month, really intense business plan where you walk through potential scenarios the way Gunther did, then you end up doing it the way I do, where fires are popping up. And you're sort of learning as you go that way.
Well,
I mean,
to be fair, I think even if you have a plan, there's fires no matter what. So there's that.
yeah, fair enough. Yeah. I try to remind myself of that actually. Yeah.
Yeah. Well, honestly, yeah, we didn't have a business plan either. So
That
yeah.
surprises me.
Yeah.
I thought
Yeah.
you and your partner had it pretty ironed out.
Yeah, no. You
Hmm.
know what was really good though was and I think we're very lucky, like us generation two or 2.0, whatever you want to call it, that we have these great DPC mentors, like you mentioned, Julie Gunther and Shane Purcell and Doug Ferrego and all these people who have written books.
Yeah.
That's amazing. And so honestly, that's why we didn't have a business plan. Although I
Hmm.
recommend it,
Yeah. Right.
100%,
Yeah.
but
Yeah.
it was just so well laid out. Paul Thomas's book, I mean, everything was just so laid out just perfectly
Yeah.
that, and we were very lucky and that we had a practice where the when we left, the primary care part of that practice just shut down because it was a multi-specialty. It was OB-GYN and primary care. And so they just decided to close down primary care because we were the only physicians. So
Oh.
yeah, so we had a lot of patients who were like, I don't know where I'm going to go.
Oh,
Yeah,
that's interesting.
yeah.
Okay. So,
It's
and you
very
were able to,
unusual. Yeah, so we could
yeah.
take all the patients that we wanted because they were like,
Mhm.
we can't handle them. We're OBs. We
Ah,
can't
right.
supervise the PAs and nurse practitioners anymore. So there were a ton of patients that needed to go somewhere. So we were lucky in that sense that we had no problem soliciting patients. Whoever wanted to follow us could follow us. So that
Right.
was that was a
Yeah.
great, we were in a very, very lucky, unusual situation.
Mhm. Yeah.
So
Well,
yeah,
that's
we
awesome.
we kind of lucked out in that sense. So maybe, yeah, the business plan, yes, I do recommend.
Fair enough.
Yeah. So, okay. So you started in 2021 and then you hired your nurse practitioner in 24. How's it been going between then until you hired your nurse practitioner?
Um, so sorry, the nurse practitioner just messaged me and I wanted
That's
to make
fine.
sure it wasn't wasn't an
See,
emergency.
this is TPC, right? This is what happens.
Oh my gosh. I'm just like, urgent. Okay. Um, so what's been going? Well, I just I started at the end of 21 and I did the whole slow growth, and I actually had planned on I was trying to keep overhead really, really low because that was the only conversation with my husband was just this idea of, 95% or something rate of small businesses fail. And um, he, he and I have very different personalities and needs. And so not that I'm always an optimist, I guess, but I tend to just think things are going to work out. As a family doctor, I have to remind myself to keep my differential diagnosis very broad, right? Because my gut instinct is generally like, we're fine, we're all fine, everything's fine, and then I have trained myself to think, okay, but if this were to be something sinister, what are those things and how do I, evaluate for those things while keeping my I'm sure we're all fine, mentality. So with the business, I believed all the direct primary care doctors, right? Like, and the model is sound. It's been around for 20 plus years now. There's lots of people, the ones you mentioned, who have been very successful and have helped create systems where everybody wins instead of everybody losing, right? This idea that patients are happy and they're well cared for and the costs are lower and all these things. So I knew that the model worked. And so I had this idea that it's all going to be fine. Whereas I had to kind of know that my husband had the mentality of small businesses fail. He couldn't understand how people would pay a monthly membership
Mm,
fee to see a doctor when they can just see him in corporate
right.
medicine. And, so he
So you're
isn't
the
as familiar.
optimist. You're the
And
optimist. He's
he's like the Uber planner, right? Like I call him a pessimist. He calls himself a realist. I think
okay.
that's semantics, but he has plans for he has backup plans for his backup plans. And, when we were, driving through Namibia, those backup plans for your backup plans came in super handy several times. Whereas, I'm like, let's just get in the truck and go. Um, so I wanted to keep the overhead low to respect his need for not going massively into debt for my little project. And so I was actually going to do a mobile clinic. And so bought a Sprinter van. And so my plan was to do home visits, but not really home visits, like bring people into the mobile clinic, and have individual memberships, but also like kind of like the blood donation truck comes to a parking lot and sees 20 people or whatever. I was going to work with kind of employer based care and see 20 patients in, this week and that, whatever. Until I tried to, so typical me fashion, I buy the Sprinter van first because my friend found one that was perfect and, gem, one of a kind, must purchase today, or, you're going to lose out on this massive opportunity. So I do,
Mhm.
and tell my husband about it that night, which based on what you know about him already was, not ideal.
Didn't go great.
Um, right? But because we are avid outdoors people and he loves alone time and he's a photographer as well, I was able to sell it as, it'll have a bed in it. You can, so able to smooth those waters. But then I tried to get it insured to see patients in it. And it turns out that having patients walk upstairs into a van is radically different than having them walk up the same number, the same type, the same rise into a building.
Really?
Who knew?
I would
So,
never, honestly, I didn't even
yeah, I
think
get it.
about the insurance part of that, but yeah.
Right. But my
Wow.
husband, the backup plans for his backup plans, right? Like insurance was top of mind. And it was, the first thing that I tried to do and couldn't do. And then my very first patient, who quote unquote signed up before enrollment was even a thing, she had a naturopath in town, and the naturopath had a family emergency, needed to exit the state. And so just said, well, why don't you just, you know, come see patients in my clinic? You don't even need to pay rent. So
Oh,
she's like, I'm paying the lease through the end of the year anyway, and I'd be happy to help you out and, whatever. And so that's how, that's how it happened. And I think a lot of DPC docs have these stories of like
just
you
random.
jump and the parachute appears, you know. So
That's
and
amazing.
the Sprinter van has been very fabulous for our camping life and for my
Oh, good.
husband's, getaways. And we got him an emotional support dog. So the two of them just go out and have a grand old time. And it could have been a marriage ending, impulse purchase, but it was a marriage saving camping adventure. So it's been great.
Oh, that's wonderful. So now you have a nurse practitioner. Are you still in the
Mhm.
same space that the naturopath lets you use, or did you move?
No, so we are still in the same space, and that is one of the current fires. Yes,
Okay, yeah.
we are negotiating a lease with in a new space, and one of the lawyers who's looked at the lease has said you should punch yourself in the nose for considering this lease, and you should just, since you're all in, you're 3 years into this thing, you're paying a nurse practitioner, right?
Buy a
You're
building.
clearly all in, just buy a building. And so he says in this email, he says, and there are bankruptcy protections for the friendly entrepreneur who's really doing her best. And, and he said, you're a female in medicine. Healthcare is a good bet. Like you're going to be able to borrow this money and you just need to be all in and do it. And so you can imagine how that conversation is going in my family. So
Mm-hmm.
good
Yeah,
times.
yeah.
Hmm.
That just, the thought of getting a loan that big makes me almost want to vomit.
Hmm. Hmm. It's really true, especially since I qualified for the PSLF
Oh,
loan
you
forgiveness,
did.
but they've never actually forgiven my loans. So I'm in that uh, I'm in that quote unquote fight as well.
Oh gosh.
Yeah,
Well, good
because
luck.
yeah. So I mean, lots of little bonfires.
Yeah, just little
Mm,
things. Little things.
it's all good. It'll be
So,
fine.
so I have some things that I do want to go over with everyone. Let's talk about what's worked really well, as far as not necessarily even with the business, but kind of how you've worked things with balancing
Mhm,
the family and the
mhm.
practice. And then maybe what would you do differently? Business plan. like that?
Um, I mean, I would love to say that if I had it to do all over again, I would take the things that I've learned and do them differently starting out. And I think to some extent I would, but then there's also just who I am, right? And um, I would not have, I don't think I would have started a direct primary care had I not inadvertently started with a network marketing company when I was, when my son, who was globally developmentally delayed, and we were told he'd never sit up and he was blind and he was not going to make it through school and, always need help. So in that sort of dark, late 2017, um, I was introduced to this company for a totally different reason. Um, and I was not joining it as a business. I just wanted to use the products. Totally stereotypical story. And then fell in love with the company and watched how this company made decisions and watched how my corporate medicine structure made decisions, and just was those were my two corporate experiences of, seeing, okay, leadership can look like this or leadership can look like this, right? And um so when I started to do the direct primary care, I had that leadership in mind and I wanted to emulate that. But through that company, I had met lots of doctors are involved in this company. And one of the doctors became a best friend of mine. And she just assumed that I knew that I had ADHD. And so she off the cuff diagnosed me with ADHD. And then I spent a year or so like, oh no, that's just an excuse, whatever, for being flaky. But I've learned a lot about it since then. And so I know that if I were to start over, um, I would start over knowing that I have that, and knowing myself a little better and being able to put up some guardrails for myself and some, behavior change stuff. But I also know that some of this is always going to be, right? Like when I'm really on it and I'm aware of where I function well and where I function less well, and I'm able to put up those guardrails, great. But there's still a lot of me in there. So I don't know that I don't know that it's possible that I would do everything Paul Thomas says in his book, right? I mean, I read it
Mhm.
and I
Yeah.
agree and I think it's true. And he has proved that that is super successful. And his path looks like that. And I think mine is always going to look a little like this.
Yeah. Well, kind of like the
Yeah,
social media. I think that his path is probably like that too, except it looks more like that.
right. That's fair. That's totally fair. That's probably true. And so yes, I would do some things differently. And so sometimes based on who I am and how I've chosen to do things, there have been more bumps probably than there might have otherwise been. But one of the things that has worked really, really well is just that I have been able to do this with my kids, right? So I have well, I'll spare you the board. But I mean, my kids come up and put notes on my board that say, you got this, mom, go you, be productive.
Oh.
I've had one day when they were young enough that we still had an easel in the kitchen. I had just randomly put down the things that were on my mind that needed to get done that day because I just had this overwhelming, like, get them out. And my oldest came down and saw it and said, Mom, is this your list for today? I think she was like 9. And I said, well, I mean, that's just the list of all the things that are on my mind. I can't make it through all those things today. And she said, well, I was thinking maybe you could just pick 3 of them and circle those ones and do those first. And then if you have extra time, you could do the other ones. I'm like, and why do we
So
pay life
wise.
coaches? Like you could just, right? I mean, people pay thousands of dollars for that advice. Um, so they have watched this process, and that's been awesome. My littlest guy doesn't even know what it's like to have, to be dropped off at daycare and picked up last. Whereas my oldest was like, do we always have, in terms of the no one's winning scenario, right? I mean, she would say, could we possibly be picked up early, maybe 1 or 2 days a week? Do we have to always be the last ones at daycare?
Hmm.
Not, and it's
Hmm.
kind of like more of a knife through the heart when it's so nice, right? It's not
Yeah.
like you always pick up, it wasn't,
Yeah.
it
Yeah.
was just, is there any way, mom, that we don't always have to be last? And so I've really been with with the slow growth, but I think even if it hadn't been as slow for me as it has been, there's just so much more flexibility,
Mm-hmm.
and
Mm-hmm.
patients are very understanding if the school calendar pops up with, and now we're doing a fifth grade play at 1 in the afternoon. You're like,
Yeah.
really?
Next week. Yeah.
Next
Tomorrow.
week. Who can do that?
Yeah.
And it turns out that I can do that now, right?
Mm-hmm.
My mom is
Mm-hmm.
sick, and I'm able to do virtual visits from Arizona, and so I can
Mm-hmm.
be with her. So this really does feel like a way to care for patients that is human, and the patients feel really well cared for. I think they actually like being able to say, yeah, absolutely, you go do that, and
Mm-hmm.
we'll
Mm-hmm.
connect via video, or we'll connect when you get back. I mean,
Yeah.
I'm not gone all the time.
Yeah.
Um, but so I think that's one of the things that has just worked really well, is that it
Mm-hmm.
allows me to be a doctor and a mom. Not that I feel like I'm doing any of them amazingly well every day, but I get to do each of them well,
Mm-hmm.
more than I got to do in the corporate structure.
Yeah. Yeah, definitely. I agree with all of that. Absolutely. So, is there anything, in the way that you have set up your practice besides the video visits that you think has been really helpful for helping you balance everything?
Oh, things I don't think of until I talk with another DPC doc. My sister actually hooked up with a direct primary care doc in her state in
Awesome.
Colorado.
Oh, great.
And she loves them. And so they were actually over at her house when I visited to, sort of talk about all the things and, have a pool party, that kind of thing. And they of the send later function in Spruce, because the idea that you treat people how to treat you, right? And so if on the one hand I want to be available to my patients, I have never though said that I will be 24/7. So I think a lot of direct primary care docs still say I'll be there for you 24/7. And the advice I got when I was starting was, well, first of all, I didn't want to have a job where I was required to sleep with my phone in my room. And also, I was told by a lot of the pioneers in DPC that patients are uber respectful, and they rarely ever get called in the middle of the night. And if they do, it's really an emergency, and they basically just end up telling the person to go to the ER.
Yeah.
And so I thought, well, then all I'm doing is delaying care by having them try to reach me. So I try to be available, but I don't want to be available 24/7. I do want to have a work-life balance. And so I use the send later feature a lot. So
Hmm.
stuff like that, like knowing that I can set this up the way it works best for me and my family, and not thinking that that then means I'm not doing a good job for the patients.
Hmm.
Because again, I had the experience of really only working technically part-time when I was in the corporate structure, and I still had, 2,000 patients on my
Yeah.
panel, and a lot of them gave me great reviews and liked me and felt that, I was a good doctor for them. So I would remind myself, like, I only saw patients 3 days a week in that structure, and they felt like I took good care of them. So if I'm available 3 days a week in my direct primary care,
Hmm.
theoretically they're going to feel well cared for, right? And now
Right.
that Julie and I both see patients, we're able to cover every day of the week. And so I think that's one of the things that we've set up that work. And just communication, right? I think patients are willing to be really, really flexible with us as long as they understand
Right. Hmm.
and they've been well communicated with, and everybody has the same expectations. And so
Right.
if with the direct messaging back and forth, if it turns into instant messenger, if it turns into like a chat with friends,
Right. That defeats
then
the
that and
purpose. Yeah.
it does, and it ends up being not very good medicine, because then I'm not putting my doctor hat on. If it's being treated like chat, then I think I engage that part of my brain instead of the doctor part of my brain. And like I said before, when my doctor brain's on, I have safeguards for myself. Think of the worst case scenario, think of the best case scenario, evaluate them both. But if I have my friend chat
Hmm.
mind on, then I'm
Hmm.
not going to do
Very different.
as thorough a job. So
Yeah.
so I've learned through the last couple years to set those parameters, and that's helped.
That's great advice. Very good. Yes. And I know not everyone's going to have spruce, but yes, spruce is great. We use Serbo, and there is a way. You're on Serbo, right?
I'm
No,
not actually.
you're
Mm-mm.
not.
I
But
use Acute. Yeah.
that's it. That's it. So yeah, Serbo has a portal where you can post date a message. Same story. You just don't want
Yeah.
people to think that you're just sitting there and, oh, they're on the computer. Let me, and you can do it with
Hmm.
email as well.
Hmm. Same. Yeah.
Atlas
Hmm.
has a thing too. So, and I think, does Acute do the same thing? Do you?
So Acute has an integration with Spruce.
Oh, okay. So they're with Spruce too.
Impressive.
Yeah.
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 Impressive that
Yeah,
he
that
was
they're
able to.
integrated.
Yeah. 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 I can't do the send later function through Acute yet.
Yeah.
Stay tuned.
Right. Well, is there anything else? Any last minute wisdom that you want to share? Tidbits?
I think I'm in the keep going phase,
Mm-hmm.
right? I mean, I think I don't know that it's wisdom at all, but I maybe shared experience that, in the entrepreneurial journey, since I went to med school and I did not go to business school, I'm needing to learn things
Mm-hmm.
that I had no concept of needing to learn. And that's part of why the whole idea of a business plan, you create the business plan, right? And that gets you started.
Right.
But I really can't imagine that there's anyone who is still operating off of the original business plan,
Yeah, no. Yeah.
even a year in, but certainly by year three, I would imagine, right? Because you've become a different person. Your
Yep.
business has become a different thing than you initially envisioned. And so I think having the goal out there and the overarching vision is one thing, and then iterating is just, I think, part of it. And
Right.
I try to remind myself that I need to have appropriate expectations for what growth and success
Mm-hmm.
look like in this journey,
Mm-hmm.
so that
Right.
when it feels kind of low and I'm like, really, I don't think I'm cut out for this.
Yeah.
I really don't.
Yeah.
Or I think I should write a book on how not to do DPC. That,
That's
like
kind of, yeah, partly. Yeah.
what to avoid, what to avoid. Um, During those times, I think it's helpful to reach out to the community and also just to know that that's just part of it. And
Mm-hmm.
and
Mm-hmm.
as opposed to hitting that low part and thinking, oh, that's it. I'm
I'm
I'm one of
terrible.
the I'm one of the ones that just can't do it. So I better
Right.
just give it.
Yeah. Yeah.
So I would say keep going. And if you feel
Mm-hmm.
like you really can't keep going, then there are people out there who will help you.
Right. Mm-hmm.
The community has been really warm, really
Yes.
receptive.
Yeah.
There's a
Mm-hmm.
lot of OG docs that are answering the same question for the
Mm-hmm.
14,000th time, and they
But they
seem
still
very
do
happy
it.
about it.
They still
Hmm.
do it, which is
They still
amazing.
seem very
Mm-hmm.
cheerful. What
Yeah.
about you? What wisdom do you have for me?
Ooh, I'd say the same thing, keep going, keep going. And I kind of have that same mentality of like, yeah, we're all going to be okay.
Yeah.
So, yeah, I definitely think keep going. And, what I'm trying to do with this podcast is giving people that sense that, yeah, if you do jump in, there's plenty of people to help you,
Hmm.
and no one's done it perfectly. I know we haven't. No one has. So
Right.
it's okay, right? That you change your business plan a month, 6 months, a year, 10 years, you know, into it. That's
Yeah.
okay. Because you're right, you
Yeah.
change. And so, yep.
It's just going to happen. And I think patients are so willing to help, uh,
Mm-hmm.
by and large, right? I mean,
Yeah.
we have patients who are establishing care with us and saying, that they're nervous about the DPC model.
Right.
It's a new thing mentally for them to pay a monthly membership
Mm-hmm.
fee. They don't understand why you would do that on top of insurance, paying
Sure.
for insurance.
Yeah.
But at the same time, they can't be seen for 3 months or 6 months or
Right.
9 months, or,
Right.
one person established care and the appointment was a year out. And by the time they had their new patient appointment, they had gotten two new notices that it was with, oh, that
So,
doctor
so,
left. Oh, that
oh,
doctor left.
no, that's terrible.
You're now with doctor three. And so they were
That's
like, even if I
terrible.
establish care with this
Yeah.
person's unlikely to be there in a year from
Right.
now. So
Yeah.
So people are willing to
Yeah,
join.
definitely. And it's just me now because, as we were talking about no one doing things perfectly, the end kind of just cut off there. And then I tried to record an ending, and the Zoom didn't record. So, yeah, that happened. But in conclusion, Dr. Kallock, thank you so much for joining me today. I really appreciated her candor and willingness to share the ups and downs. You can reach her at Erin MD at focushealthdpc.com. And she is working on getting her social media up and running. They're revamping their website, so it's going to look different in just a couple of months. So you can check it out then. Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you. This show is brought to you by DPC Ads in Minutes and Harmony Ops Health, helping independent doctors like you grow and thrive.